Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Dr. Ari Goldstein, welcome to Public Health on Call.
Thank you. It's great to be here.
So we have the privilege of having you as our sort of intern, our in-residence physician this month. But let's talk about that in a minute. First, we're going to talk about the fact that you have a medical degree. You work in medicine. Tell us a little bit about your background.
Yeah. So I am, from just outside the Baltimore city area. To begin with, I went to University of Maryland College Park for college, and then stayed in the area kind of ever since then. I went to University of Maryland in Baltimore for medical school. During that process, I was kind of deciding what path to go down, and I was interested in primary care, was interested in public health. And so I ended up doing a family medicine residency, and that was also at University of Maryland. But during that process, I knew that I still wanted to keep that public health aspect, which is what brought me to preventive medicine, where I am now. So I, applied to preventive medicine residencies and landed here at Johns Hopkins, and it's been a really exciting almost 2 years now.
And so tell us about, this is the General Preventive Medicine Residency Program here at the Bloomberg School of Public Health. Tell us about what that is.
Yeah, I think it's an important topic because I think a lot of people in medicine don't necessarily know what preventive medicine is. So preventive medicine is essentially being a public health physician. What the residency entails is both education in like a strict academic sense. So we do get our MPH as part of the residency. And then also work in both the public health side and then also bridging public health and clinical medicine. So after our MPH, which is most of the first year, we're doing rotations at, health departments, managed care organizations, federally qualified health centers, that sort of thing. And then we also do some clinical work on the side, and that goes longitudinally through the whole 2 years. And that can be a lot of different things depending on interest. So some people will do more like lifestyle medicine, like diet, nutrition. Other people are doing quality improvement. I can speak for myself. My first year, I was doing work with folks who are applying for asylum, and I've continued that actually through now. So did that for 2 years, and then for my first year, I did some work at a tobacco cessation clinic, and now I'm doing some quality improvement work with the cardiology outpatient department.
Let's talk briefly about your work with asylum seekers, because I think that's a really important example of where public health bridges medicine and these kind of greater issues.
Yeah. Yeah, the work with asylees has been very interesting, very rewarding. I did some work before medical school working with refugees. This has been a little bit different because it's more on the medical side. And so we have a couple of different programs, and it's this organization called HEAL, which is a collaboration between Catholic Charities, Johns Hopkins, and Asylee Women's Enterprises. And for our side of it, the clinical side of it, we're doing a primary care clinic for folks who are applying for asylum because, they can't really get health insurance easily. And then we also are doing forensic evaluations, which is having a detailed interview with them, talking about their full story, as well as the impacts that it continues to have on them, both psychological and physical. And then we kind of compile all that into an affidavit that gets submitted to the immigration court as part of their case.
Mhm. Now, you've also done some work with the health department. Would you talk a little bit about that?
Yeah. So our rotation second year, one of our rotations is that we have an option to do is with the Baltimore City Health Department in their Bureau of Maternal and Child Health. And I was very fortunate to be able to rotate there for 3 months last summer. And I kind of ended up there in a state of kind of transition for the Bureau. And they needed some extra support with some of these programs that really are important and need to keep going. So they have these child fatality review meetings, which places around the country do, which is essentially reviewing every unexpected child death that happens in the city of Baltimore. And we dive into kind of every detail and try to figure out where did systems go wrong? Where can we improve systems to make sure this doesn't happen again? And then we do a similar thing with fetal and infant mortality, which that tends to do with more situations that happen either just prior or just after birth, in the same context of trying to figure out where did systems go wrong and how can we make that better. And then after my 3 months there for my rotation, I have stayed on as a independent contractor, kind of consulting with them and providing them continued support on these programs.
And so then you decided to come and do a rotation with us here at Public Health on Call. So talk a little bit about your thought behind that.
Yeah, so definitely a bit of a left turn. It's been, very different from what I've done in other rotations, but still very applicable. So I've spent time at the city health department, the state health department, federally qualified health center. I spent time at the legislature in Annapolis for a month. And all of that is, different facets of public health, but whether it's, direct patient care or kind of public health systems, public health administration, it's all kind of involving communication. And this really deals with that head on. And it's kind of a crash course in how to master, public health communication in a very intentional way. Because in public health, in medicine also, we're always doing some sort of public health communication, but it doesn't necessarily happen in a, intentional manner. So being able to kind of work behind the scenes, understand kind of what thought process goes into people who are, really focusing on this day in, day out, has been very instructive. And I'm sure will be continuing to help me as I go throughout my career.
And so we've had you sitting in on recordings. We've had you kind of seeing the whole process through from the editing of the files, writing the titles and the show notes and everything that goes into it. What's your favorite part so far?
I love digging into interesting stories. So getting to kind of do some of the behind the scenes research to try to develop episodes with the team has been just really enjoyable for me. I like trying to, get a little bit of a nibble on something and then really dive into it, scour the internet, try to learn about these interesting stories that have been, extremely impactful for local populations, global populations, and really figure out, how it happened, what went wrong, what went right, and what impacts are we continuing to live with today. So I've really enjoyed that. And I have no experience with the technical side of things. So getting to learn about that has been really interesting as well. I am, the kind of person that can dive into a lot of different topics and be interested. So getting to learn about the recording and how the sound production is done and, all the different aspects has been really fascinating.
So how do you see podcasting in kind of the current world that we're in?
Yeah. So, I can speak personally that, I listen to podcasts pretty much every day. And I think a lot of my peers do as well. And that goes from my peers who are in medicine and those who are not. I think a lot of people are drawing information out of podcasts. Some of it is going to be really expert driven. And whether it's talking about these are the health issues of our day, or this is, a strategy to practice medicine in a better way, or these are the newest studies that have just come out. Or you get some of the opposite, people who are getting some that might be based on real information, real data, but maybe not with as much of an expert behind that, interpreting that. So we're seeing a lot of different just results of that. I can speak for myself, having done primary care, having done urgent care, working in the clinic, you see all of it. And you see everything that people are hearing and saying, and not in any sort of malicious way necessarily. People just come to you and like, I heard about this, I heard about that. What do you think about that? What do I do? And so I don't think it's avoidable. We have to kind of really, deal with this and understand what's happening rather than trying to kind of walk around it.
Yeah, there's a lot of opportunity there because, the relationships that people develop with the podcast that they listen to, and particularly with the hosts, that there's a real trust transaction there. And so when someone's motivations are, for example, to sell a supplement or to maybe perpetuate something that they don't have enough information about, that's where things can kind of take a turn. But then, how can, physicians think about developing those kinds of relationships with their patients?
Yeah, and I think there's different ways. You've seen some physicians who are really trying to get into the field themselves and starting their own podcasts or being guests on podcasts, and that can be very helpful, especially when it's something that's really directed more towards the public, in a organized way. But also just for any physician out there, we can be having these conversations, in the same way that when I would see, a 12-year-old for their well visit, I would talk to them about TikTok and Instagram and, try to figure out what they're actually seeing on the internet because, Lord knows. But, that holds for, people in their 20s, 40s, 60s. Everybody's kind of seeing information, and podcasting kind of provides an interesting and unique lens because you can really dive into a lot of depth on these shows. TikTok's going to be maybe 30 seconds to a minute, whereas, you get some podcasts that are an hour, 2 hours, and
Yeah.
they can really get into depth. And if we understand that and use that to the advantage of public health, to the advantage of, individual medicine, it can be really lucrative.
Yeah, I'm also thinking about the advocacy piece. Your work, for example, working with asylum seekers, like telling their stories is advocating for them. And podcasts offer this platform to kind of clue people into things that in these details that they might not know otherwise.
Yeah. I think storytelling is a huge part of it. We've seen a lot of that over the last year or so. People telling these stories that, had they not been heard, would have just completely disappeared forever. And that has like real policy impact. It can definitely change whether it's legislation or regulation, or just, how policymakers are talking about things. Can really change the narrative and can change, the actual reality on the ground. So, with people applying for asylum, like I am working with, I have one or two of these evaluations a month, and every story is like the worst story you've ever heard. They're all completely tragic, just really, really awful things. And, I did one last week. I'm doing another one next week. And I'm sure next week's will be completely unique from the one that I had last week, and yet similar in the fact that they are just awful, tragic things that should never happen to anyone. And, we have the decision to make, right? Do we let that sit and try to, even if we're supporting them one on one, or do we try to, tell the public, like, this is actually what's happening? And like, you might hear X, Y, and Z about what's happening in this country or that country or down the block, but this is the reality. And, there's a lot of different mechanisms for getting that story out there, whether it's like, writing or documentary, but podcasting is like a very modern and accessible way to, spread the message that, you know, these things are happening and we really ought to be mindful of that and take action.
Yeah. Well, let's talk a little bit about your work, where you go from here. I mean, we've stuck you in the hot seat, so you're getting the experience of being a guest on the show as well as working behind the scenes. What's next for you?
It's a great question, one that I am still exploring. Yeah, recently started the job search process, so still looking into it. I would love to be able to use both my family medicine background as well as my preventive medicine background and kind of utilize both of those knowledge bases to my advantage, to the population's advantage. Looking towards like public health administration versus more like nonprofit side. Prefer more public sector, but we'll see. I think for me, the thing that it comes down to is that like my number one passion has always been and will always be Baltimore City. And, whether it's working on, maternal child health or like substance use and overdose prevention, whatever it is, I'm confident that whatever I'm doing is going to circle around, working for the people of Baltimore City and trying to improve health and, let people live lives that are not determined by their health status or the zip code where they were born or anything else that is other than what they want to make of their lives.
Well, Ari Goldstein, we have been very privileged to have you with us this past month, and we wish you all the best.
It's been great to be here. Thank you so much.
Thanks.